The reason to enhance an image is really when the image quality is not very good. If an image quality is perfect, you don't need to enhance. Because of body size or habitus, echocardiographic images are not always optimal. People will tell you the number would be somewhere around 30%. So in 30% of all patients, not every part of the endocardium, which is the inner lining of the heart muscle, is clearly seen. And then if you try to calculate ejection fraction or cardiac volumes, when you're really not seeing the endocardium well, there is error. In those cases, injecting the contrast, ultrasound contrast, enhances the endocardium, enhances the whole LV blood pool, and then the endocardium is enhanced, and you can then stop frame them in systole and diastole and calculate ejection fraction, measure volumetric changes, and also get a much better qualitative assessment of regional function. Because regional function is a very important aspect of echocardiography. Does somebody have coronary disease? Have they had a heart attack? And if you don't see that segment, you can't call it. So Lumason has a very interesting history. It was amongst the earliest contrast agents for ultrasound that was being developed. They did a lot of animal studies and phase 1 and phase 2 studies with us when I was at the University of Virginia in the early 2000s. And then for some reason, the company decided not to develop the agent in the US anymore and developed it in Europe and marketed it in Europe very successfully for this indication. Then a few years ago, they decided to enter the US market again and apply to the FDA, and now for a year they are in this market. There are some advantages of this agent compared to some of the other agents. First of all, some of the other agents require agitation, rocking of the contrast agent. Some of them need refrigeration. This doesn't require refrigeration or rocking. It's got a kit, and you just, there's a syringe with a solution, you just inject it in, and you take out the bubble solution, and you inject into the patient. So that's an advantage. In terms of the contrast agents, they generally can almost perform equally well, depending on how you set your ultrasound system. So all these contrast agents are gas bubbles that oscillate in an ultrasound field. So that oscillation produces harmonics, which we pick up on the ultrasound machine. Now you can, if you know how to do it, you can zing any bubble to the right amount. But that requires tuning the instrument specifically to that bubble. So we have 3 bubbles available commercially here in the US. Each requires a different setting. And the indications are the same. LV cavity opacification. Lumason has got an additional indication of liver opacification. Small liver tumors are missed by CT or MRI. And large studies done in Japan have shown that contrast agents can pick them up. So they have gotten that indication, which is an added advantage, at least in the field of radiology. So if you have allergy to sulfur hexafluoride, which is the gas inside the bubble, which I have never met anybody with that allergy, then of course it's contraindicated. It is also not allowed, rather, because when the studies were done, patients with cardiac shunts were excluded from those studies. So FDA says if you have a cardiac shunt, you shouldn't be using this agent. So those are the 2 warnings or contraindications where we don't use them. So I think enhanced echocardiography is underutilized. It's underutilized despite a large number of ultrasound examinations being of poor quality. The reason it's underutilized is mostly because you have to start an IV line and you have to inject. Some labs don't have nurses around to do that. In our lab, sonographers have been taught how to start IV and they can inject it, and so the lab works well. So it is logistics which usually comes in the way. Some states, nurse alone can start an IV. So that is the problem. I think more contrast agents could be used. We would come up with more definitive answers. We wouldn't need to do other tests to answer. So that's generally about contrast ultrasound. About this agent, I'm very excited because it's the first agent in 12 years. It's giving a fillip to this whole area of contrast echo, making people believe perhaps it's valuable. Another company has come into the game. So I'm very optimistic about this field as such.